So now we're going to switch gears a little bit and introduce Eben Kermit, who is going to share with us some of the really exciting advances in training and simulation technology that Dr. Norris mentioned.
Well, thank you, Shelley, for introducing me. I'm humbled and very happy to be here, and thank you all for coming out and spending your evening with us. I'm going to take the conversation in a slightly different direction. I'm sort of the ringer on the panel because I'm not an emergency care physician. I'm just a country engineer. I design things, and I like working with my hands and fixing things and making stuff work. So what I'm going to do is talk about simulation as a way of training. And this is something that is both old and something new at Stanford. So I'm the operations manager for the Goodman Simulation Center. And let me start off by saying that and I've borrowed these slides from Dave Gaba. Dave is the dean of immersive learning and simulation at Stanford. And it's a great slide set because it talks about a training, teaching technique that can be applied in a variety of different venues and ways. But the important thing is it's not a technology. It's not just a box or a trainer or a computer. And it has a huge range of embodiments that goes from role play and dialogue. And let me start off by saying that you can sit down with a medical student and say, there's a 52-year-old man who presents in the operating room or in the emergency department with the following set of symptoms. What's the first diagnostic test that you're going to order, and tell me why? And you can pull the thread into a dialogue about the thought process and get them into the role for what they're training to do. So here's a quote from Confucius about the hands-on part of learning. You know, some people learn visually, others auditorily, and then there are the kinesthetic learners. I think most of us learn better after you actually participate in a task. Second quote, this one is attributed to various people, but one must learn by doing the thing, for though you think you know it, you have no certainty until you try. So that's the basic premise that we're going on here. We have 3 centers at Stanford and more on the target plan for building, but the focus of the Goodman Center is using a computerized robot mannequin in a simulated operating room. And let me back up and go back in time using the Photoshop for a caveman era who is rehearsing for a hunting event with his partner here before going out and actually, securing food for the family. There are several other industries that have preceded the medical industry in terms of using training and simulation, from law enforcement, firefighting, the military, NASA and spaceflight. There are certain conditions that you just can't duplicate here on the planet of being weightless, but you can do that in a virtual reality trainer. There are some other things that are specific. The Goodman Center is operated by Department of Surgery, and one of the things that is becoming more commonplace are minimally invasive surgeries, laparoscopic procedures. These have huge advances for the patient because through small incisions, you have a decreased risk of infection, you have a shorter length of stay, you have faster return to normal activity, better cosmesis, that is scarring is reduced. So there's a number of benefits. The problem is that you have to use these long sticks through small holes that have a pivot at the skin surface. And so when you do that, you basically move the handle of the tool down and to the right, and the tool moves up and to the left. So as a surgeon, you're now doing things as you would essentially doing mirror writing. It's a learned skill. If you practice it enough, you can get good at it. But it's better to practice on a simulator than it is to practice in the operating room. We also can look at interactions between personnel and basically team organizational dynamics. Who's the captain of the ship? Who's making the decisions and the calls? But it's a team effort. Everyone has to do their role, but you also have to have someone who is in charge, and that's something that we can do in a simulation center. Now, some of the historical part is that this is not new. Dr. Gaba, who's an engineer by training before he went into the field of medicine to train as an anesthesiologist, and he's also a private pilot, so he has a tie into the aviation sector, was the first one who basically said, you know, they train pilots in flight simulators, why can't we train physicians in a medical simulator? And so that was sort of the seed or the charter, which is now on an ascension. There are 3 simulation centers that exist at Stanford. There's one at the barn, which is obstetrics and pediatric focused. There's one at the VA, which is anesthesia, and the Goodman Center, which is surgery. And I'll make the digression that these are not focused, that's all they do. They're broad spectrum in that we look at other areas and medicine as a whole. So we don't do just our core focus. I mean, that's where we spend most of our time, but it's not exclusive. So this is a look at the simulator at the VA. And Cam McCowan is here in the audience. She's my counterpart as the operations manager there. There's a one-way glass mirror, and then we have a team in a simulated operating room with this mannequin. And we can change with the computer what the mannequin's presentation is. Its affect, we can change the heart rate, the respiratory rate, cardiac arrhythmias, a variety of different things. And we can write scripts. We can storyboard them like you would for a film shoot and make decision points depending on how the student actors do in their role. I should also mention that a good portion of this is theater, and it's improvisational theater. You never are sure what exactly those students will be doing, and you have to sort of go along with the flow. But at the same time, we also have Confederates on a headset that we can talk to about, well, hey, did you check the blood pressure? Did you think about ordering a diagnostic test? We have done simulations in a emergency department where we have multiple patients. So you have to think about distractions, triage, that is a priority of which patient you treat, who's the most critical, or which one can you affect the outcome in the best way. And again, it's a team effort. There are several roles that are represented in the simulator, and frequently we'll take a physician and make them a nurse. We'll take someone who's out of character to get sort of an exposure of what it's like to get a direct order from a physician if that's not your ordinary role. And sometimes there's some aha moments that occur when we put them in a different role. So there are multiple ways that we can use simulation also in terms of assessment of how things work in the hospital, not just as training for physicians. We are a medical school, and so that is certainly the educational mission is a primary portion. But we can also take a portable unit out into the different parts of the hospital and see how the hospital responds. So we'll take a mannequin down into the emergency department and we'll see how long does it take to order blood? And are they successful in actually getting the blood on time delivered that matches and is ready to go?